All right, guys, what's up? It's your girl, Benita, and you guys already know what time it is. I haven't been on for a minute, so I just wanted to jump on here and give you guys an update about what's been going on lately with me. So, this is your update video while I'm eating some frozen yogurt from a place called Delish. Um, mm, it's so good. The last time I talked with you guys, I had already took my exam for Fresenius. Um, I've been working on my own now, which has been outstanding. I love working on my own better. Um, but the job is still a whole lot. It's still a lot because we have a lot of, we work 11 to 12 hours, and it's not just a regular job where you work in long hours. It's more so that not only are you working long hours, but it's a lot of wear and tear on your body. um no, we don't have to lift patients, but we do got to set machines up. We do got to strip down machines. We do got to reset up machines. And we got to do all of this in a timely manner. They want you to be able to set up one machine within 3 minutes or less. Take down, clean within 3 minutes or less. So get your patients in and out in a timely manner. Monitor your patients, which means you have to stay on your feet. You have to walk the floor where your patients are at to make sure they're stable the whole time. And also, you have to be able to fix the machines when the machines go out. If you are not able to fix the machine, if it's a situation that's unfixable, you have to be able to unplug a whole machine. That as soon as I find out how many pounds it weighs, I'll let you guys know. But baby, it is not a lightweight machine. You have to be able to take it away, get a whole new machine, plug it back up. So it's definitely a lot of manual labor. I'm sorry, guys. It's definitely a lot of manual labor kind of thing. So that's where I'm at with that. Um, I also hadn't told y'all about that I was out for a whole week due to nerve damage in my right leg from the accident. Because if you guys remember, I was in an accident in which my right leg was injured, and because of standing so long on my feet at work, it just caused problems with that leg, and I ended up having nerve damage. I was out of work for a week, and right now I haven't even got to see the physical therapist yet, who I was referred to because of work. Because of work schedule, I haven't been able to see the physical therapist, but my leg is actually doing better. I actually don't have no discomfort in this leg right now, and thanks to God for that. But what really bothers me is like my left foot from standing so much at the end of the shift. My back be hurting before the end of the shift. So those are the kind of things that with the job, that's also how the wear and tear with your body, because you're literally always bending over to cannulate somebody or to clean a catheter, things like that. So it's a lot. But that's the breadth of the job kind of thing. So I just wanted to give y'all an update on that. Also, as far as the program that I've been waiting to get into, and you guys know that I've been on the wait list for that. I haven't heard anything about that yet. So I'm just going to still hope that I get called within the next couple of months before January starts for that. If not, I'll have to apply again. But I have started my new classes now. I've started 2 new classes, Anatomy 2 and English. I think Research and Writing is what it's called. I started those today. So when I go home, I'll do my first discussions assignment for those 2 classes. And I'll keep you guys informed on how that goes. I'm leaving an appointment today. I actually had an appointment with my gynecologist surgeon. And that was because I had already recorded a video on the day that I seen my gynecologist just for a well woman's check, which if you are a female, you should be getting your well woman check every 6 months to a year. That helps you know whether you have cervical cancer, whether you have breast cancer, and if you are an active woman, it helps determine if you have an STD or not. So it's very important as women that we make sure that we're going for our well women checkups. And I found out that a lot of women are not doing that for whatever reason, but I think it's very important that we as women, we start doing those kind of things, you know, so that we make sure we take good care of our health like we should be doing, you know. So that's what I had to say about that. So when I went to my well woman visit, was when my doctor noticed that she felt some swelling. So then she wanted me to come back for an ultrasound because she felt like it might have been fibroids. So when I went back for the ultrasound, she did detect that I actually did have a fibroid. So then she referred me to a surgeon so that I could talk to my surgeon about my options, which is what I did today. I went to see the gynecologist surgeon today to speak about my options. So what we decided, and which I kind of figured was the situation, was that my fibroid is really about this size right here. So he said that really it's small. They really can get larger than that, and that since I'm not having no major issues right now with it, he doesn't see it as a concern of something that needs to be handled right away. And there was no other fibroids that was noticed either. And because the age of over 40, he basically said that my body is going to end up going through menopause probably before I'll experience any kind of issues with the fibroid. My body will stop having a cycle altogether, you know. So and he's right about that, and that's how I felt. You know, I didn't feel like I was getting any type of major discomfort at all with it. So I was happy what he had to say because it matched how I felt. So all of that went good. So that's what my day ended today. And they had a yogurt place over here called Delish. And I was like, well, since it's right over here by my gynecologist building, I'll try some of the frozen yogurt, which is good. And then I'll talk to you guys for a bit while I'm sitting in the car before I get driving, because that can be a distraction in itself. So you guys, that was the update that I wanted to share with you guys. I wanted to just keep it a brief update on what's going on. I've really been working so much. I'm sorry, there's cars behind me. Because I've been working so much, I really haven't had the chance to really get on and give you guys a more lengthier video, you know, about the job and everything. I'm gonna try to keep you updated with the school, how things are going with the school as best as I can, but keep in mind I'm working now and I'm in school, so it's already gonna be some sort of a juggle going on. But perhaps I'll be able to bring you guys on when I'm studying. And I still been trying to record myself at the job setting up machines, so that you'll get to see machines set up. So that's something I'm just working hard to put into place, you know, for you guys in the mornings when I come in. But it's like when I get to work in the morning, I just really be focused and trying to get my machines and all of my equipment and stuff set up to get the day started. But I am going to try to, you know, get that incorporated for you guys. So just try to be patient with me. It is dialysis patient technician week this week. So kudos to us in doing the dialysis for the kidney patients. And yeah, tomorrow I'll be back at work, guys, and just trying to take a break to enjoy my day off and have a little small treat. And I'll be back with y'all. So you guys, it was real talking to you guys as usual. Love you guys. Enjoy the rest of your day, and I'm out. Bye.